Hey guys, this is Connor O'Flynn with Conquest HP, and this is my basic back pain and back mobility management video. So if you are having lower back pain right now, the steps in this video are probably a good place to start with just controlling your pain, getting back basic core function, and then starting to build mobility again very slowly at the hip and at the surrounding joints. So for the low back, the first thing you want to make sure is that you can still get a core contraction in transverse abdominis and like the deep core muscles. So that might not on its own immediately relieve pain or anything. For some people it'll help considerably, but if it doesn't immediately relieve pain, that's okay. Just know that it's necessary to properly perform all the other exercises that are going to allow you to stabilize the back, and stabilizing the back is probably going to mean irritating the tissues that are injured a little bit less. So it's a very necessary step. So first things first, I'll get you to lay on your back if you can. If you can't lay on your back, or if you can't do any of the positions that we're talking about in this video, feel free to message me and I'll give you some alternatives to use. Alternatively, if you can just use a pillow under your head or under your hips or something like that to make yourself more comfortable, go for that for now. Just do what you need to do. So if I lay on my back with my knees bent at about 90 degrees, my goal here first and foremost is going to be to get my lower back, my spine, to touch the floor. So you might be stuck in kind of an arched position. My dog. Ridiculous. So you might be stuck in an arched position. See, I can easily fit my hand under my back here. If that's the case, I just want you to kind of fold that stomach. So I'm thinking about lifting my belt buckle up to my chest until I tuck my pelvis enough and my lower back touches the floor. Just doing that should activate the core a little bit, and we can tell just by getting a little finger contact. If you just find the hip bones in the front of the hips, then move your fingers up about an inch, just directly straight up from that. When you go from one position overextended to the other with a posterior pelvic tilt, you should feel some of those muscles engage. If you don't feel them engage yet, then all you have to do is think about contracting them. So just think as though I'm standing there with you and I'm going to step on your stomach. So everyone responds to this the same way. If I'm going to step on your stomach, you brace your stomach. You just try to make the core muscles as hard as possible because you don't want me to step right into your organs, right? So touch the low back to the floor, contract the core. You should be able to feel those muscles fire up there again. If you don't feel that, or you feel it on one side and not the other, just reach out to me, contact me through Facebook or my site, or even YouTube, and we'll go from there. So I feel that core contraction now. Now I want to be able to get some hip motion and some shoulder motion without losing it. So I want to keep my fingers there just to make sure I keep that contraction, and then I'm going to start my core march. So I'm just keeping my knee bent at approximately the same angle. I'm keeping my lower back touching the floor. That's very important. And then I'm just lifting each leg alternately until the knee is approximately over top of the hip, and I'm just trying to keep that core contraction the whole time. And the next thing that I want you to do, just do 5 to 10 reps per side there. If you're feeling pain, obviously back off a little bit. Just do what you can for now. It's more of a skill thing, and it's more of a muscle firing thing than it is an endurance thing at this point. Next thing is I want you to spread the feet out a little bit, and then you're just going to kind of rock from one side of the inside of the foot, so my knee is kind of moving towards my other knee, and then the outside of the foot, so my knee is pointing outward. So I'm just internally rotating, externally rotating. If I turn to face you a little bit, you can see a little internal rotation and external rotation at the hip. So if I do that nice and slow and controlled, the same ideas, I'm keeping the lower back flush to the ground, I'm keeping that core contraction. Then what I'm getting is a good range of motion at my hip inflection, a little extension, and internal and external rotation, which are all very important. Move, bud. Move. Which are all very important for things like squatting and bending and just basic daily movements, let alone exercises. And I can do all of them with the core contraction. So that's first things first. After you manage to do that and you're pretty successful at it, just do a couple rounds with it. Make sure you really nail down those movements with the core contraction. Then you can take this to the quadruped position. So quadruped is essentially hands and knees, with my hands beneath shoulders, knees beneath my hips. And you can keep the ball of the foot on the ground for a little extra support if you want. But I want to think about that core contraction here too. So I'm really contracting. I want to feel the muscle tense just above the hip bone. So once you get that going, I'm going to start you off with some basic shoulder movements. So get that contraction, try to maintain a flat back here, put a broomstick or something on your back if you need to for feedback, or use a mirror, and then keep one arm straight and just raise it up until the hand is approximately shoulder height. Repeat a few times, and again, you shouldn't lose that core contraction. So I'm creating as much tension through my shoulder, through my arm muscles as I can, lifting under control, lots of tension through the core muscles, lots of tension through the glutes the entire time, because you need to learn to manage this tension. So repeat for a few reps on one side, and then repeat for a few reps on the other side. And if there's no pain there and it's pretty easy for you to do, move on. And if it's a little harder to do, do a few more of them until you feel more comfortable. After that, you're going to stay in this quadruped position, maintain your flat back. And the way you maintain that flat back is keeping your glutes squeezed and keeping your core contracted. That should get really annoying, right? Me saying that all the time. So core contracted, glutes squeezed, and now I'm going to do a quadruped squat. So I'm just sitting my hips back exactly as I would if I were doing a barbell back squat. And the idea is that I want to keep my back straight for as long as possible. So for my range of motion, right about there, I feel that if I was going to go any further, my back would have to curl. Now I don't want it to curl. I want to have as much hip range of motion as possible without my spine moving. That's the best way to kind of desensitize that pain. So I'm getting a lot of tension in the core and glutes. Ease back, pause at the end of my range of motion, and back up to the top. You can kind of push into the floor with your hands and create a lot of stability, a lot of tension through the arms and the shoulders as well. That's always a good idea. And this was something that I did when I hurt my back not too long ago. And when I started out at first, I wasn't painful at the top position, but I could only move about this far. So I would just repeat sets of 20, only going as far as I could without pain. It's important that all of this happens without pain. If you're engaging pain all the time, you're just sensitizing the tissue further, so you don't want to do that. So just go with whatever range of motion you can. I'm just sitting my hips back, touching the end position, and then coming back up. Once you manage to do a little bit of that without pain, then we can start to make it a little more exciting. You can try to lift one leg at a time. Now this might be a little too challenging for you, but if you can do it, do it. Just to do a hip circle. So I'm just going to pull one knee off the floor, and then just do a little circle counterclockwise with that knee for a few reps, and then the other way, a few reps. Goes without saying, lots of shoulder tension, lots of hip tension, glute tension, core tension, and then repeat on the same side, or on the other side. So just popping a knee off the ground about ½ an inch, and little circles. My back does not move anywhere. After you do that, keeping the back still again, think about as though you have a bowl of water or a bowl of soup or something like that on your low back. You don't want to tip the soup. So just lift the knee straight out to the side in kind of a fire hydrant movement. So I don't want that low back going anywhere. If I'm twisting so far that I have to twist through my low back, it defeats the purpose of doing this in the first place. No back movement, lots of muscular tension around it if it doesn't cause pain, and don't touch painful ranges of motion. That's what you have to work on with all of this. So those are the basics. What you can do after that is just work on some breathing. So in quadruped position again, I want to really focus on diaphragmatic breath here. So you'll be able to see my stomach move. Now, seeing the stomach move like that means that I have some control over those abdominal muscles and they're okay contracting and relaxing. And just doing the deep breaths, especially the long exhalation, think 5 to 7 seconds exhaling, that's going to really calm down any painful tissue. So a very important thing to do. And now that you've relaxed a little bit, you can work on cat-cow a little bit. So cat-cow is a flexion extension movement, which normally, as you should know now, and by this time in the video, that could aggravate things. So you're going to have to really ease into this. We want to just kind of test what range of motion you have, and just work with the range of motion you have without irritating anything. So flat back, and then I go into my cat position, where I'm just curling my spine a little bit. Again, a full range of motion for me is going to look like this. Really tucked pelvis, really flexed back, and then the cow position, I'm not sure which is cat and cow actually, means extending as much as possible, looking up, turning my tailbone up, pausing briefly, and then reversing. And again, when I hurt my back not too long ago, when I started out with this movement, my range of motion looked more like this. You might not be able to see that at all, but compared to my full range of motion, you'll understand that I was pretty limited by my pain. So do not engage pain with that. That is just to reestablish normal pain-free range of motion. Eventually, over time, you'll be able to push the range of motion a little further, but for now, just be really calm with it. Don't push it any further than you have to. Pushing into that painful zone is not going to help you recover faster. It's going to delay your recovery. So just do what you can without pain. If everything's painful, then you can just skip the exercise and come back to it once you have a little bit less pain to deal with. So this is just a basic series just to kind of get you moving again. It's meant for people that can't even hinge at the hip, that can't bend over or squat or do anything like that at all. So if that's you, work on these things, because eventually we can take all these drills, progress them just a little bit, and it turns into squatting and deadlifting and push-up and all that kind of stuff. And that's just kind of how you reintegrate a little bit of stress into the system. But first you need to focus on that core contraction, create a whole lot of stability around the low back, only push your mobility as far as you can without engaging any pain, and just use the breathing to calm down pain. So work on those things, get as many reps in as you can without pain. Plan on just spending 15 or 20 minutes working on those things just for a little light movement, and eventually it should kind of desensitize those painful tissues and allow you to get back to something a bit more exciting. So more on that coming soon.